nanobodies.
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 I think by the name, everyone understands they're small.
Nanobodies are the llama, alpaca, camel version of antibodies. At night, I go to bed thinking about nanobodies. When I daydream, that's what I daydream about now. New ways to develop these and push them faster and farther.
Many of us know and understand what antibodies do. They help us fight infections by essentially signaling to the body, this is not good, can you take care of this, please?
The small size of nanobodies is a significant potential advantage. There are parts of our body where antibodies just can't get in. They're just too big.
Now, why does that matter? That matters because it helps them access areas of the body that the larger antibodies can't get access to. For example, the brain.
The rule of thumb is about 0.1% of what you administer gets into the brain. And nanobodies, just by virtue of being 10 times smaller, 10 times more get into the brain.
For example, you may target things that are currently causing issues such as Alzheimer's.
And actually very specifically target molecules that we think are important for preventing or slowing down Alzheimer's disease.
Thinking about building out this therapy for one of the most difficult to treat cancers, malignant brain tumors, there's multiple challenges. Dr. Fryer brings to the table this unique expertise of developing and identifying new nanobodies to target these brain tumors.
All of my colleagues that live in that space between basic and translational research, we do things to try to discover, here's a cell that went bad. And let's try to discover how did it go bad? And let's try to target that with a drug, a small molecule, or an antibody.
Nanobodies give the capability of engineering cells in new ways, given their small size. Instead of having the capability of expressing 2 or 3 proteins to recognize the cancer and overcome these barriers, maybe I can engineer it in ways with 3, 4, 5, 6 strategies because of the smaller size.
The other real advantage here is the ability to hopefully be very targeted in what you're doing, which should let us focus on the cancer and leave the healthy cells alone.
We're really excited about this work because for the first time in my career, we're generating things that we see a clear path to a patient.
Part of the success of TGen is the way it operates. It operates very quickly, very nimbly. That allows for fast experimentation, fast failure, or fast success. That combined with clinical expertise at City of Hope allows us to do things in a way that could not be done in the past.
Philanthropic dollars really make the accelerated part of the Center for Accelerated Nanotherapeutics possible. Otherwise, it would just be the Center for Nanotherapeutics.
A lot of things that are funded in science are baby steps forward. And that's really, really important. But there are some times we need a giant step forward. And throughout TGen's history, the support of those philanthropic donations, they've helped us take that giant step.
I am incredibly optimistic. I feel like we're at the cusp. I know it's going to lead to new ideas, new therapies for patients, and I believe breakthroughs.